I've been coming up to Papua New Guinea since 2007 and I've travelled a lot throughout this country, but right here in the Barma region is definitely the poorest region I've seen. Even when people do find the means and the ways to get to these clinics, they arrive there and there's just no supplies anyway.
There's no hospitals around there, no aid posts. Most of them are not educated so that they can't be able to look after themselves.
The health challenges in the Western province are enormous. We have some of the lowest health indicators. When I came to office, I was overwhelmed.
The excuse for the tyranny of distance, terrain and remoteness are used to explain why around 6 million men, women and children in Papua New Guinea don't get the basic services they need. It is an excuse, but not a justification.
My small sister died because she was delivered on the ground. They never take them to the hospital. We used to drink water from the river. Some of the children will get diarrhea. They used to die.
It was one thing to hear statistics, but to come here and look into the eyes of a child who's going unconscious with malaria has really touched my heart.
Seeing how my people are really suffering, it really affected me and really changed something in my heart.
There definitely needs to be a lot more dentists in the country. Most of the dental problems actually faced by people who can't get access to services. And so if you have a toothache and to travel 1 week, I just can't imagine that.
There's some unacceptable health inequalities in the world, and we have the opportunity to make a difference.
Change in Papua New Guinea is not impossible. Already, we've reached 594 villages, delivered 249,000 health and training services, and upskilled 551 healthcare workers with our current ship, the MV Pacific Link. A new ship will help us reach further upriver, across more provinces, with more volunteers, and for longer lengths of time, increasing our work by over 500%. This means 1.3 million people, a quarter of the nation, would have access to healthcare, immunisations and health training. The ship will operate as a mothership. Patrol tenders will be launched from the vessel to reach extremely remote coastal communities with essential health and training services. The new vessel's operating theatre, dental clinic, outpatient medical and surgical facility and lecture rooms will treat isolated villagers in desperate need and train and upskill healthcare workers, medical students and dentistry students to help PNG develop their own nation. An onboard laboratory will diagnose and treat disease and give access to help world-class experts develop new strategies to see long-term change and development to beat infectious disease.
I look at these strong babies trying to fight off an infection and I see all over their face, I want to live. And I work with the community health worker serving in this community and I see I want to live written on them. And it draws out of me this strong cry that I think unifies all of us, that we want to live.
Will you help Papua New Guinea overcome the impossible?